My name is Gabby Baker, and today we will be talking about sleep apnea. Sleep apnea is a very common sleep disorder affecting roughly 20 million Americans. Sleep apnea is a condition in which a person stops breathing periodically throughout the night. When a person stops breathing in their sleep, they are partially awakened from sleep as their brain is forced out of deeper stages of sleep to get the body to begin breathing again. There are 3 different sleep apneas, and the first one is obstructive apnea, the second one is central sleep apnea, and the third one is mixed sleep apnea. And the first one we are going to talk about is obstructive sleep apnea. This is the most common sleep apnea for people. This is caused by partial or complete blockage of the airway during sleep. During sleep, a person's throat muscle relaxes, allowing the tongue and fatty tissues of the throat to fall back into the airways and block airflow. During an apnea event, air is restricted from moving beyond the obstruction, reducing blood flow to the brain. This then signals the brain to partially awaken from sleep to signal the body that it needs to breathe again. Some obstructive sleep apnea symptoms are snoring, frequent breaks in breathing, morning headaches, restless sleep, and depression or irritability. There are causes and risks for this. Some are weight. This is for people who are overweight or obese are more likely to have sleep apnea than those that maintain a healthy weight. Sleep apnea can often be caused by excessive fatty tissues that become built up in the neck or throat. This can lead to restrictions in airflow as the upper respiratory system's pathway is narrowed or pinched off during sleep. Another is age, enlarged tonsils, frequent alcohol use, and smoking. There are different surgeries where you can get this done just so you don't have it anymore, and the most common one is nasal surgery. The next one is central sleep apnea. This occurs when the brain temporarily fails to signal the muscles responsible for controlled breathing. Unlike obstructive sleep apnea, which can be thought of as a mechanical problem, central sleep apnea is more of a communication problem. And some symptoms of central sleep apnea is stop breathing or irregular breathing during sleep, shortness of breath, excessive daytime drowsiness, chronic fatigue, headaches in the morning, restless sleep, mood changes, snoring, and difficult concentrating. Some treatments for this, there's not as much as the obstructive one, but you can get medication for it and phrenic nerve stimulation. Phrenic nerve stimulation is delivered by a pacemaker, and it monitors respiratory signals while you sleep and helps restore normal breathing patterns. Because this device is implantable and turns on automatically during sleep, you do not have to wear a mask. And the next one is mixed sleep apnea, and this is a combination of both obstructive and central sleep apnea. The treatment for this is adaptive servoventilation. These are machines are capable of performing a breathe-to-breathe analyzation and altering its setting accordingly. So this is the one where you have to put it on your face during the night. The 3 things that I think best would help sleep apnea is the weight, being healthy and reducing the fatty tissues around your neck. So eating more healthy, exercising. And then the phrenic nerve stimulation, that is to monitor respiratory signals. It signals stimulations through the brain while you're asleep to make sure that you're breathing throughout the night. And the adaptive servoventilators help you breathe throughout the night. So I think these are the best 3.